When we evaluate patients for surgical treatment of essential tremor, we want to make sure that they've tried all the other possible therapies. So medicines, other types of adaptive technology like weighted utensils. Turns out many patients have tried all of this and for years and years just has had no benefit. And that's where focused ultrasound comes in. It's incisionless, so it involves basically lying still in an MRI scanner, and we use 1,024 small ultrasound beams that are all focused in on that same target in the thalamus, the motor thalamus. When they converge at the target, they become very powerful, and they can heat up that tissue and melt it away. And by doing that, we interrupt that faulty circuit, and we can make that person's tremor go away. The MRI scanner needs to have a patient be in exactly the same spot. So we place patients' heads into a modified Lexel frame, and that frame keeps their head very, very still during the procedure. We also slip a membrane over top of that frame that sort of outlines an area of the top of their head that we will then flood with water, and that keeps their scalp cool during the procedure because these ultrasound beams actually heat up the scalp quite a bit.
Trace a line in between these two lines here and try to not intersect these lines. Make a spiral and end here.
We have those spirals and the various parts of the neurologic exam available, and we test the patients out in a sitting position and then also when they lie back on the MRI table. In a stepwise manner, we will first turn up the heat slightly so that we can basically see a small trace of where the lesion is going to be, but we haven't done any damage yet. And we do that at least 2 or 3 times in order to make sure that the lesion's going in the right place. And after each one, we'll pull the patient out of the MRI. We'll test their strength, we'll make sure they're not having any numbness or tingling, and most importantly, we'll have them draw those spirals.
Oh wow.
Like a lot better.
Yeah, that's some progress already.
That will show us if we're making any incremental improvement. Because as we turn the heat up, as that lesion expands, we expect to see more and more benefit for their tremor. And then we test again once they're out of the MRI scanner and sitting back up. And that's generally the best that it's going to get. They leave the hospital after just a couple of hours. They're walking out on their own power, and they have this truly life-changing benefit for something that they've been dealing with oftentimes for decades.